Welcome back. It's a vaccine that has proven to be successful at preventing certain types of cancer, yet many parents are still uncertain about whether or not their children should get it. Today we are getting real with Dr. Tamara Bavousett, a nurse practitioner with her own practice, Compass Pediatrics. We're talking about the HPV vaccine today. You have girls, I have girls, we've talked a lot about this. What is HPV and what does it cause?
So the HPV is human papillomavirus. So big word, really there are 100 different types of this virus. And it's circulating. It's estimated that most people in their lifetime will come into contact with this virus. So it's very prevalent. But where the concern lies is that there are 4 different serotypes that can cause major problems. And that's what we vaccinate against.
So, I mean, we're talking about cancer-causing virus, if
Absolutely.
It's the right strand of that.
Sure. So, type 16 and 18 of the virus can cause cervical cancer, and it's estimated that 70% of all cervical cancers are related to this type of virus.
Wow, there is a direct correlation. So, I guess the next question is, how is it transmitted? And this is where it kind of gets touchy for those of us who have children, but it's a conversation we need to have. So, how is HPV transmitted?
So, HPV is a sexually transmitted disease. In fact, it's one of the most prevalent STDs that we see in the U.S. Right now it's estimated that there are more than 20 million people that are infected with HPV, and upwards of 6 million per year may become infected. So that's a lot. And where it gets tricky when we talk to parents is how this is transmitted. So it is a sexually transmitted infection, and that doesn't mean that they have to have intercourse. And so when we have to talk about that, then we really get real with these parents. It is just any way that they come into contact with the genitals. It doesn't have to be sexual intercourse. It can just be touching.
Right. And so we all know what that conversation is. That's what you're so good about too, is when you're in your office having those discussions. Boys and girls should be vaccinated at what age?
So you can give it as early as 9 years old. What I recommend in my office is that we start at 11 or 12 years old, because that's when they're coming in for their standard boosters anyway. And it's a good time to talk to the children. I usually talk to them by themselves for just a little bit, make sure there's no questions they have for me they don't want to ask in front of mom or dad. And I can really educate the family and the child on why this is important.
And it's a series of 3 shots, you say, right?
That's right.
So let's talk about some of the myths. This is a safe vaccine. We've had time to test this, but I know there are still people who are always concerned about vaccinations. Are there neurological issues? Are there side effects that go with this?
So the side effects that we commonly see are pain or redness at the injection site, sometimes headache or nausea, and on the rare occasion we do see children that faint. And so that's why we usually give the vaccine when they're sitting down. If they feel faint, or they know that they usually faint when they give blood or get a vaccine, we have them sit or lie down for about 15 minutes afterwards.
Okay, and the last question is, some people see this as a green light to promiscuity. You have a very different take on that. I mean, this is a lifesaver.
Exactly. So, this is, the only cancer vaccine that we have for cervical cancer and for anal rectal cancers. So why would we not give it? If it's estimated that most people will come into contact with this virus at some point in their lifetime, and of those, they could develop a cancer or genital warts, then why would we not want to protect our children? It's just like everything else that we want to, protect our children from. And I think what it really comes down to with this vaccine is education, and just to be open and honest with your healthcare provider, and get all the answers before you get out there and get the vaccine.
Thank you for talking so frankly with us. For the record, both of our girls, all of our girls, we have 4 between us, will be getting this. Dr. Bavousett, thank you so much for being here with us.
Thank you, I appreciate it.